down some of the things you say and put in the chat box so you will know, I will know. Is that okay?
Sure. I don't
So
wanna spend too much time, I'm sorry. I tried the
yeah, it's
LDN
okay.
several times, and I
Mhm,
stopped every time because it was too much. Then I started reading your postings about the endorphin depletion,
mhm.
sensitive to medications, not functioning
Mhm.
well kind of people, and that's me, because it developed into this chronic pain, and I'm pretty much disabled. I mean, I walk, I can
Do
do
you have
things, but I'm
swelling?
very deconditioned. Swelling?
Is there swelling, color disration,
Yes.
color?
It but it's color discoloration, swelling, but both feet are swollen now. I have edema on both ankles. It's developed.
Yeah.
I ruled CRPS was more or less ruled out, but then some people said it is, and then one person said it isn't. It's not a clear case of CRPS. Um,
I think
and
you
the
have an
swelling,
atypical version of CRPS.
um,
Usually CRPS history, one limb injury with lots of neuro dysregulation, and then pain on that side, swelling on the other side, teaches the other side, and then at some point even upper or lower like contralateral side, the other side can learn, and then if it's
right.
low, upper can learn, if it's upper, lower can learn, and then your
Mm,
body just becomes on fire pretty
yeah,
much all
yeah,
the time.
yeah,
So
yeah,
that's
yeah,
what it
kind of.
sounds like to me. I can't make a
Mhm.
diagnosis, of course,
Right,
but
right.
it sounds like atypical. We used to call it reflex sympathetic dystrophy. I kind of like that name
Mhm,
better, but I also see the
mhm.
reason for that CRPS. I think so. Do you have a question about LDN? I
The q
understand
Yeah, I have a
your
question about the LDN. So I'm now on it. I started taking it in August. The doctor prescribed it to me, said how I can dose it however I want, but the lowest I can do is zero point 0.1. So I'm on zero point 0.7. I don't know that it's helping me. I don't think it's harming me. I just think my pain and my swelling and all that is kind of not going away or getting worse at times. So I'm just wondering if there's a chance if I should try to increase it. Should I not?
yeah. Those
Should
are
I
all
try add
medical
anything?
questions that you can
Yeah.
talk to your doctor about. And
Okay. So yeah, the
uh,
doctors don't know that well. But my question was that
no, find one.
is
Find one that knows well. What state are you in?
yeah. I'm here in Switzerland, and in Switzerland, no, almost nobody knows about it,
Oh,
unfortunately.
of course.
In
I
Germany,
no,
there's
that's
yeah,
I don't think
yeah,
that's true. In the big group, we posted from Switzerland, and the question was, can insurance cover LDN?
right,
And the answer was it depends. So I know that even
right,
in Switzerland, there
right,
are people who take LDN, which means that
right.
you can find doctors who can take LDN,
I,
and
I yeah, yeah. I've tried all that, and it was for long COVID, and I can't get in touch with that organization. These people
I'm
take it for
sorry.
long COVID. I don't have post COVID symptoms, but it doesn't matter. I mean, I'm still in any case. But even if I go back to US, I can find someone. Is there any other thing that you recommend, or that's a medical question too, like any other
Yeah, I mean,
medications that I
you
could
can.
ask
Why
a
don't you
doctor
post?
about?
You can ask AI to turn your I know your personality is very direct, and I respect that.
Mm-hmm.
I'm like that too. So what you can do is ask AI, hey, help me out and turn these direct questions into like non-medical solicitation advice, and
I
then
see.
just post it in our. Don't do it in
Okay.
Facebook, do it on School, and I'll do my
Cool.
best to answer it.
Okay. Okay. That's a good idea. Thanks a lot. Thanks a lot. You're the
Okay,
first
thank
person
you.
that said anything useful recently about diagnosis, so thanks. No,
Well, but I didn't diagnose you. It's just I said it
you didn't,
reminds me
but
of my patient.
you said there is an atypical because I'm always convinced that this is something, it has to be something like that.
And I
So,
think
but nobody
Beatrice,
believes me.
part of it is your personality, and mine before I studied, I had 30 years of experience in medicine, is that we want black and white, we want direct, we want definitive, but we also have to, like, after seeing a lot of patients, it's just really humbling to understand that diseases don't read textbook, and there are a lot of more atypical conditions than it's taught. And
Hmm.
classical condition is really hard, and rarely you see it in that portion. It's always a twist, curve, and that's why when people say, "Oh, aren't you scared of AI?" It's like, no, because what
Hmm.
we do better than AI is a nuance. Like if
Hmm.
AI doctor talked to you, AI would have said, "You don't have CRPS." when you talk to me, I'm going back to 30 years of perspective of all my experience and say, 30 years ago when you didn't have RA factor, then you were faking it. You didn't have RA. If MRI did not show MS, then you're faking it. I think we had that kind of mentality, and now we have such things as RA negative rheumatoid arthritis, and we have MRI negative and
Oh,
CRPS doesn't even have tests. So, and the
right.
diseases don't read textbooks, but generally it starts one side, it does a thing of its own, and then the other side says, "Hey, I want to learn too." There's a
Right,
party.
I know, right, I wanna learn too, right, right,
Yeah,
and the rest of
the
the
whole.
body says, "I wanna learn that too."
Oh
Right.
yeah, exactly, exactly.
Right,
So
right,
LDNs for
right.
me, in my idea, um, and in my system of starting people, I always I just ask them three questions. Are you a sensitive person? Have you had this condition long time? Are you full of vitality? So if and then each questions have a numerical value, and depending on the number, I start people on zero point 0.1, 0.1, and
Right.
0.001. That would be
Mhm.
point 0.1 is 100 micrograms, point 0.01 is 10 micrograms, and point 0.001 would be 1 microgram. So
Mhm.
I think that's just how I have developed it. But recently, I have a patient who she cannot even take 1 microgram. So we are taking, I don't know the exact dose, but she's diluting
Mhm.
it to nanogram range, and she says she's doing fine. And I told her just like um, go ahead and increase it at will. And whenever I
Mhm.
start, I pretty much give the rein to my patients. They're living with their body
Right.
24/7. They're the experts, and I'm just there as like an advisor to help them. So, and then you
Right.
in CRPS is really, 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 really a bad monster. It be best to catch it right away. So in my practice, I
Mhm.
have two tools that's really helpful. One is LDN. We talk about that. The second is basically hacking of the nervous system. I have different ways to hack nervous system, and
Mhm.
these are inspired by my masters in acupuncture. But they don't do acupuncture anymore. What they do is communication with the body, communication with the nervous system, communication with brain. So let me explain you more. In Western medicine, when you have stroke, that's it. You don't have ability to regain function. In my clinic, that happens almost every week. Someone is able to walk again, and they're able
Mhm.
to talk again, or talk better, or they're not having problems with aphasia as much. So there is a way to activate the nervous system. There is also a way to deactivate the nervous system, and there's probably two or three people in the U.S. who know how to do this, and one of
Mhm.
them just retired. So now there are probably two people who really know how to do this, maybe less. So I can't solicit. That's another illegal thing. That's just but you are not in the country of US, which means there's a mechanism that you and I could probably connect using one of the secure connections, and then just talk. And as for paying me, you decide. I mean, there's like a tip service that I created called Buy Me Coffee. And then in my case, it's books, but you can buy me a book or so, whatever you determine. I won't tell you how much it is because
Mhm.
I know in your
Mhm.
personality
Mhm.
you won't like that, but I can tell you how much I charge per hour, but not applicable. So if you're interested in talking to me, actually outside the US is easier because
Oh,
um, outside US, I'm just talking. I'm nobody. In the US,
right.
I am licensed in certain states, and so then I can't do the coaching in those states, but I can do it in outside the US because I don't have any license in outside the US. US state is part of the US. So it's complicated, but the fact that you're in Switzerland actually makes it easy. And you have access to the Dixon chemist. You have access to your doctors or whatever doctors, even 50 milligrams. 1 to 100 is what? 50 milligrams, so zero point 0.5 milligram. 1 to 100 is what? Is 5 microgram. 1 to 100 of that is 50 nanogram. Those are very easy to do. Amazon sells kits.
Oh,
Um,
I have a solution. I have a lot. I mean, I have enough suspension, but it's point. 0.2, or I don't know, it's point for 100 milligrams or something. I don't know. The one drop ends up being 0.1
Mhm.
milligrams. So
So,
that's the lowest. I
Beatrice,
don't know
I
how to
hope this
dilute
was
that
helpful,
further, but
and I will let other people have a chance to ask question. I really appreciate you being here, and
okay.
this
I,
is
I will
something
be
we
in
couldn't
touch
even do.
then. I'll try.
Yeah,
Mm-hmm.
yeah, that
Okay.
sounds good.
Thanks a
Thanks,
lot. Thanks a
Beatrice.
lot.
I appreciate
That's
you. Have a
okay.
great day or great
Thanks.
evening in Switzerland, right?
Thank you. Thank you.
Yeah. So I'm grateful to Jill. Jill is here. Yay. I just am so grateful to Jill. Without Jill, we would have been dead in the water with the Facebook. And I think it didn't hurt that we implemented all these defensive uh, protocols to um, protect ourselves from breaking the rules accidentally. But it looks like it got broken anyway, and we got flagged. Um, but it is what it is, and because of I and I'm just learning so much from Facebook, and because of Jill has done such a great job, we're going to probably turn the first um, group into our archive, post only by admin. We're going to probably just keep that, and that will keep that place safe, and then people can go there and search through the archives. And the only thing is that I have to remember to close my own comments. Otherwise, people can put their nasty things, and then we'll get in trouble again. So, Sharon, do you have any questions? You are here after Beatrice, so I want to make sure that I can get you. Oh, yeah, Jill is amazing. We're just we're so lucky to have Jill. And then Wendy, do you have any questions? Otherwise, I'm going to ramble, and everyone will get tortured by rambling. All right, so let me look at all these. We do have Nicholas, who is 11 year veteran nurse. Yeah. What question do you have, Wendy? Oh, just type it, no problem. I mean, I love this format because it's such more interactive than the live. But at this point, it's like Facebook Live. So you just type it, and then I will do my best to answer it. Um, it's long is okay. Just type one sentence, enter. Type one sentence, enter. Or you can put it on AI and say type everything and say okay, shorten it or turn it into clinical note, and then it's no problem. Take your time. Take your time. So anyway, I think the Facebook is going after the health groups. I've heard that there's a group that's like half 500K or half million people, and they had no compunction to turn that off. The Madeline's group was 1,000 when I joined, and Madeline asked me to help out, and I did. And we get to 2,000, and then it got just like vaporized. And one of the members of that group is calling me names and very, very upset, taking it personally. And I explained to him this morning that it's Facebook, his questions, and I try to take his name question, turn it into AI, and then make it clean and post it. But I still got in trouble doing that from thing. So it says, "What's your thoughts about split dosing?" I think it's a really great idea. Split dosing makes a lot of sense individually. When I had a neuropathy recently, I did split dosing. I took one dosing in the morning, one dosing in the evening, and the weekends I would dose it 3 times. And so I think split dosing is a good idea. And dose doesn't really matter. It's the dose and what it does that matters. We want effective, we want safe, effective. So I think that it's okay to do it 2 times a day. The bigger thing is what's the effect? No effect, no problem. Usually, no effect means you can increase the dose. But there are times that, like, I knew that I activated sciatica, and I knew what to do. I had to take LDN in high doses very quickly. So I did, but I was dying. I had nausea, all these things that people complain about. I got so one day I would take high dose, take a break, take a break. Next day I would come back, same dose until I didn't have any of the reactions, and then I went split dosing. and then did it again, and then the pain went away. So then now I can take it once a day. So it says that, let's see, talking about November for chronic pain and Hashimoto's thyroiditis, um, previous existing resurfaced, intensified. So there are two things about this. Is that number one, is and he wrote other things too, massive pain relief and less brain fog. He's got HED, autism, and ADHD. But I think the autism you're talking about, I'm guessing, is more of a spectrum rather than full autism. So, and you're a super mom, and we appreciate old moms, and we appreciate moms who are being tested through children's condition. And for me, that played a huge role. It taught me about mold poisoning, taught me about MCAS. So I learned it that way. So this is so chronic pain and Hashimoto is a kind of different kind of condition. That one is autoimmune, the other one is dysregulation of nervous system. Let's see, is this better? Because then some people say that I have to talk into the microphone, and I'm talking into the microphone. So yeah, and I'm so glad you told me, because some people said you need to buy a expensive microphone. It's like I already have one. It just I don't do what I'm supposed to do, which is talk into the microphone and hold it, or get an automatic holder. So the the idea, I think, is that you have to engage one dragon at a time. If you LDN can do all that and more, but you need, that's what I think a provider is useful. I think that the providers who just give their license, use the license to prescribe, are, I think, less useful. And I think that when people ask me about AI, it's like, well, the thing that AI has difficult time doing right now is the perspective, because perspective takes a lot of memory. And the perspective I have here is that you cannot engage all conditions at the same time. That would be the best way to torture the person. So I would say find someone. Where are you located, Sharon? You. I think New Hampshire. Um, I am in Texas. I do have a in real life practice in the country of Texas, Fredericksburg, Texas. Very lovely area, German influence, very quaint and very tourist friendly town. And if you are able to come, come. Otherwise, find someone. New Hampshire is don't they have Dartmouth and all these schools? So I think that, but you just have to find. You don't need many. You just need one, and then there's going to be probably telemedicine doctors like me, who is um, covering different states, and New Hampshire is a fair state to cover. So, like for in my case, I'm beginning to train doctors and some nurse practitioners who have what we call independent status, practice status, and those people um, can and will be able to be trained by me. So I'm training them right now. And it's an apprenticeship mentorship program, and I have two right now I'm training, and third one contacted me and we were not good match. Fourth one contacted me. I'm not sure we're a good match. And my practice is that way too. In the one in Fredericksburg, all comers, but in my private practice, I interview patients up to 2 hours, not one time, but several times, several times. And the reason for that is I want that to be ideal practice. And I'm not an ideal doctor, but I think I can be ideal for some people with some conditions who are looking for a problem solver. And that's me. I like solving problems. What probably I will not be as good as would be if they're using me as a counselor. I think I will suck at that. So, and there are people who are really good at that. So people should go to that. Sharon, I think, said she's in UK. So I'm happy to talk to you, Sharon. I think I put my website. Again, there's no determined fees. If you ask me, I will tell you how much I charge, but it doesn't work that way. It's more buy me a coffee, or in my case, books. But it's completely up to you, and any amount is appreciated, and that amount goes back to running these groups. Like school charges me 100 about $99 per month, and then in the website is charges me something, and so on and so forth. And I left it to voluntarily um, to cover. And I think that there's one person who contributed, but school also allows me to maybe sell the primer and whatnot, which I can do that. Not I just need this side of the equation to pay for itself, and it's not doing that. But I love doing it, so my wife says I can do it for now. But it'll be best if we can I can make this like self perpetuating financially. And Jill and Charlie and other people, I mean, they're all volunteering their time. I would love to put on a conference or like just meet and gather in different parts of the world. I did tell Jill that I would love to go to where she lives, and I would love to put on like a meet and greet. I think they have like Sussex Arms and Anchor and Crown, or Crown and Anchor. I would love to. I mean, things like that. I would love to do. No, I wouldn't. I think that online conference is possible, but then I would have to. I would love to just meet people, and we can make it online for people who don't come. But I would love to go to where Jill is, and there's got to be a place that we can broadcast, and then maybe for dinner or lunch or brunch or something like that, we can just gather or just gather in a pub and uh, say hello to each other, or coffee place. It doesn't really matter. But I would love to do that. The the um, the donation link actually is called Buy Me Coffee, and I will upload that. And it's really, like I said, any I'm just trying to make this sustainable, and that's all I want. And so if any help that can be given would be fantastic, but it's not an expectation. And the same thing with people outside the U.S. It's compliant for me to talk to them, so I'm talking to them. It's not safe for me to talk to people in the U.S. because even I tell them the rules, people want what they want. And remember, our group, we posted the rules. All that was done, but people do whatever they want to, and that is how groups disappear. Madeline Scott group disappeared, and I think that there was another group much bigger than us. They got hit several times and then they disappeared because Jill and I and Charlie have been very awake and very vigilant. I think that Facebook AI on the second round gave us a pass, but I think that that's a warning. That's a second chance, and I think that will become our standard operating procedure. Is that when our flag site gets flagged, we'll appeal, and then immediately we will turn that into admin post only, and then create another group to just move forward. And and of course, school. I think that school is going to become our main site, and there's another group called social. I just haven't had the chance to look at everything because I do have a real job. I work Monday, Tuesday, Wednesday in a nearby city about 60 miles or 1 hour drive. And then I stay there Monday night, Tuesday night, Wednesday, I come back. And then Thursday, half day, Friday, half day, and Sunday, half day is my private practice. And it's a small practice. It's 99 people capped, active patients, new patients, probably average of 2 people a month. And when I hit 99 active patients, probably I will go to closing the mode part because to me, the current model, what's wrong in the US at least, is that it's based on volume. Wherever my career was setting up these programs in healthcare systems and take insurance and make the access easier for many people. But what happened is that 2 to 3 years into that, the administrators walk in. I call them the suits. The people wearing suits come in and say, Dr. Kim, we love your program. Patients love your program. We hate your program. because you're not making enough for us, and we know there's a potential to make a lot more for us. And at that point, what usually happens is they suggest see patients quickly, don't care about their outcome, and they don't understand that when you see patients quickly, how about like Beatrice's case, so complicated? How about Sharon Sun's case, so complicated? You can't solve those issues 15 minutes. You can't say, Beatrice, go, and then 15 minutes. If you 15 minutes, it's about 7.5 minutes. I have to cut her off and say, let's do this. It's different because I'm listening to Beatrice and trying to problem solve, look at the big picture and whatnot. Same thing with Sharon, big picture. But it's my patients. I have to know. I have to know preferably everything I can know in 2 hours, and that's what I do. I do. I. What happens is that when someone says I'm interested in your practice, I interview them and I take notes on them, and and then look at the notes and see if I can help them. If the chance is greater than 70%, then I will talk to them about joining me. Before they join me, I send them terms, and then they have to look at it, and then they have to sign it, and then only then I'll take their money. Because in the US, you take someone's money, you already have a relationship, doctor patient relationship, and I don't want just anyone to enter my practice. I only want people who want help, who I can get better, and it'll be better that if those are not mean people, and because I they make me unhappy, and that there are other people who want to fight with everything. Like in the beginning, I had 1 page agreement. Now I think I have like 15-page agreement, because every time patient create problem for me, then I put that in the agreement. Like people want to no show, people want to just cancel last minute, people want to argue that it's a membership, and they want to pause the membership, and there's no, and I tell them no, but they say it's not written. So now everything's written. So I told you I'm like Beatrice. I like black and white better than clarity better. And if it takes paper 10, 15 pages of computer paper for them to go through so that we will not have unpleasant conversation later, so be it. And some people probably freak out and say, I don't want to join this doctor. He's got too many rules. That's okay with me. How frequently do I see patients? Monday in Fredericksburg, Tuesday Fredericksburg, Wednesday Fredericksburg, and then Thursday afternoon, and then Friday afternoon and Sunday afternoon. And you would think that I have a lot of patients. I try not to have a lot of patients. And the other thing is, if they're better, even when I say, "How are you doing?" They're like, "I got better things than to even reply to that." Then I know they're doing okay. But
No,
these
I
people are.
meant, sorry, I'll just say frequently. Look, if you let's say you see person for the initial, how often do you see your patient usually?
It
Average,
depends.
like
So let's say I just saw one yesterday, has pain, and we're gonna use LDN. And what what happens is that I got LDN is gonna take about a week to go there. Supplements gonna take a week. So plus 2 weeks, 3 weeks. I want to see that person one more time. Until they're tucked in, I want to have a plan of action, and then probably 3 weeks, 4 weeks, 6 weeks. Um, but they can contact me anytime. The evening times, I try not to book, because if there is something that's urgent or not emergent, but something that's urgent, then I can use the evening, Thursday evening, Friday evening, Saturday, Sunday evening. So those are what I call reserve time. Saturday is my day of rest usually, except for this, because our Jill is in UK, and 6 p.m. just doesn't do it for Jill, because that's 12 a.m. her time, or 6:30, 12:30 a.m. Um, Sometimes I'll fuss at Jill saying that it's late. But Jill's really good. She'll say, I'm getting ready to go to bed. And then I'll say, yeah. So online conference is possible. If someone wants to organize it, I'm happy to participate. But my dream is, why do I have telemedicine practice? Because I really want to meet some of you in person, um, and especially the leaders, like moderators like Jill, and Charlie. It's we are doing this because we love it, and I see them elsewhere too, other groups. And no, I don't care. I mean, it's good that they're helping with their expertise in LDN, because there's so much unknown about it, and sometimes just not true things. And even in our group, one of them, I think, used AI to generate content, and I don't think that person knew that AIs can hallucinate and communicate. So the person kept on saying, "This is from AI. It can't be wrong." I said, "It is your post now. It doesn't where it came from is up to it, not irrelevant. Your post, it's wrong, and you're out, and don't come back." It's terrible, but that's because I was afraid of FB, and I also don't like misinformation in our group because I want our group to be last one standing in the Facebook, and I would like our group to, like, if we say something, at least plausible, um, but don't say that's false. I don't think that's really a good idea for us to have a sustainable group if we have false things flying. And it's 11:03. If Jill has no questions, then I will sign off soon. Jill, do you have any questions, comments? Jill's is ex librarian, so I know that she loves being put on spot. I think Jill is probably more of an introvert, observer, kind, gentle type of person. Or Jill is on mute and she likes it that way, which is fine. So thank you so much for coming, and I really, really, really appreciate your presence here. And I'm gonna probably do this 6:30 on Fridays, which is 11:30 Sydney time, and 10:30 on Saturday mornings, which is about 4:30 in London time, or Greenwich Mean Time, where time was invented in England, so, or in the UK. So thank you so much, and I appreciate our community. And I'm sorry that all the changes came almost at one time, but I want to assure you that your leadership has been our leaders have been preparing for this. I would say about a month. When Madeline's group got vaporized, I knew that it's not far away, that it's our turn. And then another one got vaporized. That one has like almost 70,000 people. Then we started discussing. We looked at all kinds of things, and I liked school the best. And it turns out it's actually better than Facebook. I just didn't know it at the time. And then Facebook will turn into more of a pointing device rather than a serious discussion, because I don't. I mean, I have an AI agent trained on community safety, and I followed all of them. And even then, um, it's my bad. I use the ChatGPT, which is not as reliable in the free version. If you use AI, you owe it yourself to get the pro version, because pro is much better. So I will bid you a good Friday, Saturday evening to Sharon and Jill and Beatrice, and it turns out all you from Europe. So it kind of worked out that there's an evening time, there's a morning time. US, I think this is the time people do up and about and do things, but in UK and Europe, this seemed to be a not a bad time. Well,
Very good
everyone,
time.
thank you
Thank you
so
very
much. I
much. I
appreciate
will be
you.
in touch. Thank you so much, Dr. Kim.
Thank you. All right, bye bye.